So the next part of the exam is the reflexes. We'll just take a look and let it go nice and loose. And this is the brachioradialis, and you can see how nice and perfect that is. So really that's all you need to do unless somebody had neck pain or weakness on one side of the arm, showing that the reflexes are normal. In the lower extremities here, let it go loose. And we still can generate a reflex. And we have reflexes nice and normal down here. Reflexes are 0 if they're completely absent. If we couldn't get it the first time, we can distract people. And this is a grade 1. So for example, if I couldn't get the reflex here, I could ask her to take your hands and pull them apart. And then if I could get the reflex, that would be a grade 1. And that's called the Gendrasic maneuver. But her reflexes are normal. In patients with muscle disease, if they're getting very weak, eventually you'll lose the knee reflex because the muscle is just too weak to generate a reflex. But in clinical practice, we really only need to do the brachioradialis, knee jerks, and ankle jerks. Ankle jerks are lost early in neuropathy and lost late in myopathy in the knees. Sensory examination, Aaron told us that there was no problems at all with numbness or tingling, so we just are going to do a quick screen. Sometimes patients with muscle disease and other neurologic disorders can have deficiencies, things like vitamin D deficiency, vitamin B12, or even pre-diabetes, which can affect the nerves. So with a tuning fork, it has to be a 128, not a 256, when you're testing this. So what we're going to do is just let your leg go loose. Do you feel the buzz down here?
Yes.
Good. Tell me when it stops.
Stops.
Okay. Perfectly normal. And we'll just check it here. Do you feel the buzz?
Yes.
Tell me when it stops.
Stop.
Perfectly normal. So we're just going to check the sensation. Now, she doesn't have any issues at all with numbness and tingling, so just a quick screen can be as simple as taking your tuning fork, which is cold, touching it here. Does that feel cold?
Cold.
And cold up here?
Cold.
Yeah, so she can feel the cold there. So we're testing the two main sensory pathways. Pain and temperature is carried by one fiber, and vibration and proprioception is carried by another. So those are both perfectly normal. We would not expect those to be abnormal in a muscle disease, so I don't believe that you have a nerve disease, because usually these would be affected with a peripheral neuropathy.
Okay.
Now, either with your tuning fork, you could do it here, or with your reflex hammer, you could also just scratch the toes. And she has a bit of a withdrawal response, but if she had corticospinal tract issues, the toe would go up. So for example, if there was a stroke or a spinal cord problem, and the toes will usually fan out, but her toes were going like this, but not up, so that's normal. Usually they will stay the same or sometimes curl down. The abnormal response is toe up, and the toes fan out, and you don't have any issues there at all. Okay, so what we've established is that there's definitely some proximal weakness there. You did tell us that it was hard sometimes to get out of a chair, to get up from the ground, and you said that your gait was off a bit too. So I think what we'll do now is just if you could sit in this chair, which is a little bit lower, and we'll just see how you get out of the chair, and take a few steps for me, please. Okay, so I'll have you sit there. Good. I'll just stand over here. And what I'd like you to do, whenever you're comfortable, just try and stand up the way you normally would at home. And then if you could just take a couple of steps for us. Okay? Go ahead. Okay, that's great. And then have you come back. And then just sit down. Okay, so that's the gait that people were talking about. Is that correct?
That's right.
Okay, so what we saw is that getting up from a chair, because of the proximal weakness that we saw, it was impossible to use the strength just to stand up. So Aaron, what you were doing is you had to put your hands down to compensate and get yourself up from the chair. And because these muscles are weak here, when you're starting to walk, the hips are dropping a little bit and it's giving you a bit more of a sway.